Revlimid has been approved only in the context of multiple myeloma. So this is the first time Revlimid or Lenalidomide, which is an immunomodulator essentially, is approved in the lymphoma. So it's approved in mantle cell lymphoma, being the second drug ever approved in mantle cell lymphoma relapse refractory setting. So what was really remarkable in this phase 2, although as you're right, we had evidence of activity of lenalidomide in lymphoma across the board, including mantle cell lymphoma for quite a while, for a few years. But it took a while to try to generate enough data with a phase 2 focusing on patients who are more heavily pretreated, having failed the standards that we use in mantle cell lymphoma, which is cyclophosphamide, doxorubicin, rituximab, and bortezomib, which is the first drug ever approved in mantle cell lymphoma relapse refractory setting. So we had here 134 patients who all had failed that would do very poorly in the context of regular chemotherapy and have a very poor outcome. This patient response rate was 29% with close to 8% CR. But what was very important is that the duration of response. With a regular chemotherapy, in patients who have a median of 4 prior therapy from 2 to 10, standard chemotherapy or even high-dose conventional chemotherapy, which translates into very short clinical benefit. Here, the median duration of response was more than 16 months. And when you look at the subset analysis, in which we presented at ASCO last week, we actually shown that the patients, regardless of the number of prior therapy, bulky, high tumor load, prior high-dose chemotherapy, refractory to the last therapy, or refractory to bortezomib, by definition they had been exposed to bortezomib, but some patients were refractory to bortezomib while on treatment. The response rate was very similar, and the duration of response was very similar. So translating into a clinical benefit.